Good day, ma'am, and assalamualaikum. I am Mutalib Johanna. Today, I'm going to perform the assessing of the nose in sinuses. Assessment of the nose and sinuses involves a physical examination to evaluate the condition of the nasal passages, mucosa, sinuses, and other related structures. This includes checking for abnormalities like congestion, discharge, deformities, tenderness, or inflammation. The purpose of this is to identify any signs of infection, blockage, or structural problems in the nasal passages or sinuses, to assess for common issues such as sinusitis, allergies, or nasal polyps, to ensure proper function of the nose and sinuses in relation to breathing, airflow, and mucous drainage. The equipment is pen light or flashlight to inspect the nasal passages and assess for any obstructions, drainage, or abnormalities. Gloves for hygiene purposes during palpation and examination. Consideration patient comfort. Ensure the patient is comfortable and relaxed during the exam, as this involves touching the face and nose. History. Gather any relevant history such as allergies, previous nasal surgeries, or recent symptoms. Infection control. Always use gloves and practice proper hand hygiene to prevent cross-contamination. Cultural sensitivity. Be aware of the patient's comfort levels with physical touch, especially in sensitive areas like the face. Allergies. Take note of any allergies and sensitive to medication, as they affect the sinuses and nasal passages. Things to document after the procedure. The nasal patency, whether both nostrils are open and clear to airflow. Document any obstructions. Nasal mucosa, the color and texture of the mucosa. Note if it's pale, red, swollen, or congested. Discharge. Any presence of discharge, its consistency and color. Symptom. Document the appearance of the nasal symptom. Is it straight, deviated, or perforated? Tenderness. Record any tenderness over the sinuses, especially the frontal or maxillary sinuses. Tenderness may indicate infection. Sinus infection. Use the pen light to observe any visible swelling or abnormalities over the sinus areas. Smell sensation. Document any loss or alteration in the sense of smell, which can indicate nasal or sinus pathology. Patient symptoms includes reports of symptoms like pain, pressure, post-nasal drip, or headache. Inspect the external nose. Note size, shape, color, and flaring or discharges from the nares to detect abnormalities. And lightly palpate the external nose to assess for areas of tenderness, masses, and displacement of bone and cartilage. And instruct the client to close his mouth, occlude one nares, and breathe through the opposite nares to determine the patency of both nasal cavities. Close ka, sungari ka. Then, ginawa ni. Then, repeat it to the opposite side. Kasabala. So, next is for nasal cavities. Use a speculum and a pen light to inspect the nasal cavities to visualize internal nasal structure. Ask the client to tip his head back to allow better visualization of the nasal cavity. With the pen light, shine a light into the nares to inspect the nasal mucosa for color and any edema, lesion, inflammation, growth, or discharge. Then repeat it to the opposite side. Next is palpate the maxillary and frontal sinuses to assess for any tenderness. Next is for the frontal sinuses. Shine a light against the aspect of the supraorbital ridge of the frontal bone to assess for tenderness or inflammation. Next is for the maxillary sinuses. Instruct the client to open her mouth and shine the pen light to the left and the right to detect opacity or blockage in the sinuses. Okay? That's all po.